had the bug. The bug had already bitten me that we can make substantial change for the better and help people make substantial change for themselves for the better. It is very, very difficult to be at home with a person in dementia for 24/7, 7 days a week.
Yeah,
you know.
What's going on, everybody? Today you are on the CAREpreneur Show, and we are in Baltimore at the NADSA conference. It's the last day. We've had a great time. Got a very special guest with us who is really a huge advocate of the adult daycare space. And Roy is the public policy advisor for NADSA and the formerly just in the legislature in Pennsylvania. He also has his own consulting firm and is really helping us advocate at a state and federal level for the adult daycare space. So that being said, Roy, thank you so much for being here, and I'm really excited to kind of just hear about your journey, because I know you have a huge heart. You're super passionate about adult daycare itself, and it's great to have someone out there advocating for us at a state and federal level. So, that being said, thank you for joining me.
Well, Kris, thank you for giving me the opportunity, especially to talk about adult day services, because it's something that truly is valuable, and many, many more people are going to need it as the population continues to age. One of the very good things about medical science is that it's been able to save lives and extend lives much further than it did 50 years ago.
Right.
But the downside of that is many of the people who are living longer are in need of the kind of help that can only be available at either home health care or through National Adult Day Services centers.
So let me ask you this, though, because before you got into this adult daycare, this passion for adult daycare, because clearly you have it. Yes. How did you get into lobbying, and then at what point in time did you shift your focus to this space?
Well, my journey was one that evolved, as you might imagine. I started out in politics as a sophomore in high school as one of the Kennedy kids for Jack Kennedy's campaign in 1960.
Wow.
And then, of course, after that ended, and then he was elected, obviously, I went into the United States Air Force. I served with the Air Force in England, as well as a couple of states here in the United States, and became more and more interested in government and politics at that time. And then I became one of the early volunteers in the state of Pennsylvania for Bobby Kennedy's campaign. Well, of course, that came to an abrupt end, as everyone knows, on June the 7th, I believe it was. But I had the bug. The bug had already bitten me that we can make substantial change for the better and help people make substantial change for themselves for the better through government, by providing opportunity, information, and that sort of thing. It's not all about money by any means. It's about willpower and dedication and the willingness to do something. And so I evolved into that. And then my big break, so to speak, in politics was to run the campaign for a state senatorial candidate in Pennsylvania, whom no one gave a chance of winning. But we defeated the incumbent majority whip during that campaign and put the Senate in the hands of the Democrats for the first time in quite a few years. That immediately attracted a lot of attention to us. How did you do that? All that sort of thing. And he asked me to be his chief of staff, and I served in the Senate as his chief of staff for his entire 3 terms of 12 years. I was then elected to the House and did 2 terms of 4 years total, and then was elected to the Senate and did another 3 terms in the Senate for a total of 12 years. And then my friends came to me and said, you've got to run for mayor of Allentown and be the mayor of the city of Allentown, Pennsylvania's 3rd largest city. And I said, no, I don't have to do that. But you can only say no to your friends for so long before they stop talking to you. Right. So eventually they talked me into it. I said, all right, I'll do it, but 1 term and out. Because if I do what I think has to be done to get the city of Allentown back on track, it'll be very difficult for me to get reelected anyway.
Right.
So when I did that and satisfied my friends, and then the 1 term and out, I created the Afflerbach Group, LLC, with the sole purpose of being able to represent those entities that otherwise either could not afford good representation or just didn't know how to go about it.
Gotcha.
And my real goal
did you have
is to train them.
At that time, did you have an area of focus? Was there a certain type of company or organization that you were kind of thinking that you would want to help, or?
I didn't have a specific area of focus, although I wanted to gear myself toward nonprofits, because they were the ones that had the least ability to hire a good lobby firm or a good advocacy firm or even a good advisor for how to deal with government.
Right.
And I thought, you know what, a lot of these folks really helped me along the way, and now I had a chance to help them.
Yeah, it's
So,
awesome. That's
yeah,
awesome. Yeah,
yeah.
so that whole giving back.
Yeah,
Like this,
exactly
the
right.
spirit of making a difference.
Sure,
And
sure.
that's what it's
Well,
all
and I'm
about.
very fortunate because I'm in a position, and I was at that time, where I had a nice state pension coming in. It's not exorbitant, but it was a nice
Right,
state pension
right.
to keep me alive. So all I have to charge my clients is enough to pay my travel expenses for them
Yeah,
and be able
yeah,
to do that sort of thing.
I
Just
feel like no one thinks like you. Like, I feel like we need more people like you.
Look at all the fun I'm having.
I know. I'm like that.
I'm
I'm like,
76 years old.
I'm
I
just
feel
like,
like a 50-year-old.
right. Like I love that. Like just being like in your mind, you were so mindful of like who you were trying to serve at your own even expense.
Sure,
And so
sure.
that's
so
I feel like that's such a
I started
honorable
out,
thing. So
if I may, I started out at first with an actually for-profit company. It was a doctor who was trying to start up the distribution of a particular unit that he had invented, which allowed people to have their medications dispensed through remote transmission, so that the doctor would write the prescriptions, somebody would pick up the prescription, the pills, and almost exclusively pills, of course, put them in this machine in these different compartments, and by remote calibration and remote instruction, the machine would beep or send out some other signal and dispense the right amount of medication at the right time each day.
What year was this?
This would have been, I have to think about that for a moment, 2006.
Okay.
Now, since that time, there are a number of these machines out on the market that are working that way.
Yeah.
All right, and that was a good benefit.
Well, no, I'm saying it's I mean, like that's what I was thinking when you were telling me your story. Like the thing that that sounded like it was probably a while back, and like that technology was like probably just coming up then.
That's exactly right.
Yeah,
He was one. There was only one other one that was
Yeah.
under any kind of field testing at that
Right.
time, which was located in Ohio, Cleveland, I believe.
Right.
And his would have been the second one. And since that time, there's a proliferation of, I don't know how many, but quite a few.
Yeah.
But in doing that, there were some folks from the Pennsylvania Association of Senior Centers that noticed I was now in the field and could do maybe something for them. So we went in, did an interview, gave them a rock bottom price because they had never had a lobbyist or an activist out there on advocating for them, and started working with them. And then one board member there happened to be also a board member of the Pennsylvania Association of Adult Day Services.
Right.
And so she convinced them they should talk to me and get me on board for them as well. And of course, there was a lot of overlap there.
Right.
Then NADSA came to Pennsylvania in 2011 or 2012 for their conference, and invited me to do a 3-hour pre-conference for them on advocacy, how to do it, how's the best results, all that sort of thing.
Gotcha. So the time you started out, it's kind of like just a speaker, I guess, like a.
Yes, exactly,
Yeah.
yeah. So I went out and did their 3-hour pre-con, and afterwards, the incoming president of the group came over to me and said, how much would it cost us to have a lobbyist in Washington?
Right.
I said, well, if you want to go to one of the top lobby firms, now remember this is back around 2011, 2012, somewhere in there, you can expect to spend $250,000.
Wow.
Well, that was way beyond any kind of budget that they could possibly have.
Yeah.
And he said, can we do anything cheaper than that? I said, sure. I said, you can hire somebody off the street, and you might get away with paying them maybe $60,000 plus fringe benefits. So you're still looking at a possibility of $90,000,
Right.
and you're going to have to train them.
Right.
To some extent.
Yeah.
Or you can bring somebody in that's already working with another organization in which you have some like interests, and they can give you some part-time service at probably a much lower rate. But bear in mind, if you do that, the downside is when the issues come up for their main employer, whoever they're serving, those are the issues they're going to focus on, and yours might fall off the table. So it's not an easy decision.
Yeah.
Well, he got back to me a little while later, a few months later, and he said, what kind of a proposal could you give us for part-time work but sole on, and I said, listen, I'm already representing Pennsylvania. If I can combine the two for the exact same issues, we can do a pretty good deal, I think. And so that's how it got started. That's how I got into National Adult Day, and that was 2013 I started with them, and here we are, 8 years later.
Right. That's awesome, man. That's awesome. So when you think about like what outside of obviously like them needing help and stuff like that, what is it that like when did your like passion, or when did you really kind of like hey, there's something about adult daycare that's special to me,
Well, I happen to be from a family, because of my age as much as anything else, that was a rural family in Pennsylvania, and I watched my mother take care of my grandmother, her mother, including providing hospice for her at home, in her home, and doing all the things, and my father, of course, helping her out and so on. I watched her take care of him as he was in his passing years. I knew quite a number of other fellows and gals that had somehow one or another having to care for their parents, aunt, uncle, grandparent, whatever it was. And I said, these people really need some help, especially when they're caring with someone who's going into dementia, because it is very, very difficult to be at home with a person in dementia for 24/7.
Yeah.
7 days a week.
Yeah,
you know,
100%. It almost can really kind of push them to limits that, like, you know, that make it, like, you know, that make them resent their loved one, and make, you know, just from a mental health standpoint, almost like it can be like hard on them, you know.
Well, and you hit it right on the head as well. Not only can that occur, but their whole physical health can deteriorate also.
100%. Yeah.
And so then I went out and looked at some of these senior centers and some of these adult day centers, and I began to see people that I knew that had supported me for public office.
Oh, wow.
I said, how can I not do this?
Yeah, right. Wow. So what, when you think about, like, where adult daycare is today, from a policy standpoint, like, what is it in your mind that you feel like is kind of like is like held adult daycare back, like, from being able to really be what we all know it has the potential to be?
Right. There have been a number of things over the years that have held it back, and slowly but surely we are overcoming those things.
Yeah.
From a pure numbers standpoint, there are private insurance companies out there that can look at the numbers and say adult daycare is the best buy for home and community-based services.
Right.
It's the best buy to help keep people out of expensive institutional care, and it's the best buy even to home care.
Right.
Because you can congregate individuals, and therefore you get a better buy having 5 or 6 or 7 overseers.
Yeah, a shared cost.
A shared cost, exactly.
Yeah. Which
Plus,
insurance companies love that, right?
Oh, absolutely, absolutely, yeah. And those numbers are coming out every year from the insurance companies. So why wouldn't government not look at that?
Right.
And especially in the Medicaid and CMS and so on. They finally began to look at it when Seema Verma came in as the commissioner of CMS. There's not a lot of things in the Trump administration that I really appreciate, but bringing her into CMS was a good one.
Gotcha.
Not everyone in ADS will agree with me on that.
Right.
But the one thing she did do was move CMS to begin to find ways to have adult daycare, whether it was health care or whether it was just the social aspect of it, get a whole lot more recognition and be included in Medicare Advantage.
Got it.
So that's something, of course, that's still in its infancy, but that was something
hey,
that
it's a step, right? I mean,
yeah, that's a step. Prior to that, what's held them back? Not having a uniform definition of exactly what adult day is nationwide. The fact that it's very, very disjointed among the states. Each state has their own idea of whether adult day should be licensed or not licensed, registered or not registered, certified or not certified. There are some states that just simply say, okay, you want to open an adult day center, go ahead, open it up, pay their licensing fee and pay your taxes and let us know if you close.
Right.
That's about it.
So
there's just no standard of care that's uniform across the country.
Yeah.
Everyone who is doing it, so far as I can tell, there's a lot less fraud in adult daycare than there is in many of the other provisions of health care and long-term services.
Right.
And in part because everyone who's doing it is really committed to helping these individuals, and the inspectors can go in and see the people right there.
100%.
You know,
Yeah, it's true. I was honest, because when you think about all the home care Medicare fraud that was in Miami, and you know, billing Social Security numbers on people that had been passed away, and just crazy stuff, you know. So,
well, and think about it. Even with electronic visit verification, which the
probably have stuff to trick that.
You know, that's to try to get at some of that. But it's still very difficult.
I know. And you know the hard part is, like from a operator standpoint, we have a home care agency as well. I try to stay out of Medicaid, and we were about, like, you know, our daycare is about 10% Medicaid, and our home care is about 20% Medicaid, and the rest is all private pay. But on the Medicaid side, the administrative workload, like on the EVV verification, is unreal. Like it is, and so it's like it's kind of like hard because you see like all this money going to this administrative work, you know,
and you know those are dollars you could put into serving the people you serve.
It's pretty wild. So anyways, but
and then the other reasons they just never had a consistent lobbyist, or a consistent lobby approach, or a consistent advocacy approach.
Right, someone that's just like pushing the needle every day. You know?
Exactly, and networking with all these other organizations that can be collaborative, who have the resources to have people in Congress on the Hill, except for the pandemic, of course, but every day of the week. Right. So that's what we're now doing. That's what we began doing when I came on board with them. I said, you know, we've got to become part of these collaborations.
So what do you foresee the future being like? Like what would be like some goals or milestones that maybe that you might have for us, like over the next, you know, couple of years here? You know?
Yes, well, one of the milestones is within reach at this point.
Okay.
Senator Casey is leading the charge in the United States Senate, and there's a companion bill in the House with Representative Dingell, and these particular pieces of legislation would include a requirement, not an option, but a requirement that every state would have to place in their state plan for home and community-based services, long-term supports and so on, Medicaid for adult day services.
Got it.
If they're going to collect Medicaid, then they have to place in their state plan all the things which Medicaid approves, including adult day services. That's big, because
Right.
it means that the states no longer have to rely on waivers and getting them reapproved every 2, 3, or 4 years, whatever.
Gotcha. So then it's like at least that one thing right there is unified in itself.
Correct.
Right? Yeah.
That's exactly right.
Yeah.
And by doing that, it'll also lead to, I think, a greater understanding of what adult day is from a national description.
Right.
NADSA, of course, as you know, has put together a definition, which we worked over 3 years on
Right.
to be able to put together to make sure that we covered everything that needed to be covered. We are encouraging the state affiliates to be able to pick up that definition, use it when they talk to their congressional representatives, their United States senators, staff, their local officials, and so on. And the more we do that, the more uniform we'll have and the greater experience we will have.
Yeah.
Now, there's one last piece, and I'd be remiss if I didn't leave this on the table for you. NADSA has no political action committee.
Gotcha.
All right, you get attention in state legislatures and in Washington by being able to make contributions to candidates and elected officials. And they don't have to be straight cash contributions. They can be buying tickets to breakfasts or lunches or dinners that they're doing as fundraisers.
Right.
That is just not possible for NADSA, and it's really not feasible for the state associations either, because
like
it
how
takes
much-
a lot of work to put a political action committee together.
Like how much money would it like would someone an association need to raise for something like that?
Well, it varies from state to state, as you might imagine,
Yeah.
because the focus here is on the state legislatures and the state administrators.
So a PAC for a state level, you're saying?
Yeah, state level PAC would
Yeah.
be good. And again, because of the manner in which the different states operate, some states, as you know, have a maximum 90-day legislative period.
Right.
So obviously you don't need as much money in those
Yeah,
states,
yeah,
all right?
yeah.
Other states like California, Pennsylvania, Michigan, and so Illinois and so on, have much longer, in fact, for all intent and purposes, year-round legislature
right,
meetings and so
right.
on. That requires a bit more. I can tell you that one of the other organizations with which I work happens to represent animals, and we created a Pennsylvania PAC for that group. We started out very small with $3,000 to $5,000, targeted that money very specifically. Over a period of about 6 years, we have built that up to a sum now of around $60,000.
Gotcha.
And now people are paying attention to us. Now legislative candidates are coming to us and asking for the reviews and the endorsements instead of us having to go to them and beg.
Gotcha.
And,
That's
we
awesome.
don't contribute to all of them either. What we do, again, is target our funds.
Right.
So,
To the very specific, people that we know are going to be able to kind of help
Exactly.
carry the cause.
Sure.
Yeah.
And we're still small potatoes.
Right,
In
yeah,
the whole healthcare lobbying system in
Yeah, yeah,
Pennsylvania,
I know,
I just
I know,
looked at
yeah,
these
yeah,
numbers
yeah.
the other day. It's in the vicinity of about $30–40 million.
Right.
All right. So
yeah,
we're really small potatoes.
Right.
all
No,
But
I hear you.
it's enough to get attention.
Exactly.
Yes,
Yeah.
that's the key.
We're
And-
making it's
and
progress.
the beauty of that is, if you choose the right fundraisers to go to, the right
Right.
breakfast or the right lunch,
Right.
there's a number of other legislators there, not just the one who's holding it.
Right.
So
right.
you get 4, 5, 6, 8, 9, 10 people to talk to.
Sure,
And
sure.
that's a good use
making
of the funds.
progress. Yeah, absolutely. Well, I appreciate all that you do on behalf of NADSA, and I know just being a part of NADSA now for 3 years, you've constantly been this very consistent voice from a kind of legislative standpoint, and so I know I'm super grateful for everything you're doing, and just thank you for everything you continue to do. So
Well, you're very welcome. And
I
as
appreciate
long as I'm healthy and able, I'll keep doing it. And right
Awesome.
now, I'm about as healthy as a horse. So it's going to be for a while, I think.
Awesome. Well, I appreciate it. So thank you so much. And guys, if you haven't already, Roy is a big part of NADSA, and make sure if you own an adult daycare, if you're thinking about getting into adult daycare, if you want to support the field itself, reach out to NADSA. There might be ways that we can kind of coordinate and work, with Roy to get this message out there and help kind of bring that voice to both the state and the federal level. So thank you guys so much for joining me on this episode of the CAREpreneur Show. We'll see you on the next one. Make sure you like, comment, subscribe, show some love, and let's get back to work. Hey guys, thank you so much for making it this far. If you'd like to watch last week's episode, click here. If you'd like to watch more exciting content on senior care, click here. If you'd like to learn how to open up your own adult daycare, assisted living, or home care agency, click here, krischanna.com. This is for all those senior care entrepreneurs out there. And let's get back to work.